This is Dr. Shilpita Banerjee from Neotia, Rowden Street. I am here to speak a few words about how to manage high-risk pregnancies. Now, when we utter the word high risk, there is always a palpitation and increase in heart rate amongst the patients and the attendants. But to put it very simply, with our complicated life, stressful life, nowadays we are facing more complications in pregnancy than before. And we all have to admit that a pregnancy in a family nowadays takes a lot of time, a lot of visit to our gynecologists and obstetricians, and a lot of management plans as well as financial stress. So how can we as high-risk obstetricians help you? A few simple steps is very important for us. If we divide high-risk pregnancies, it can be a high risk due to the mother or a high risk because of some complications in the baby. So whenever such a patient walks into our chamber, we find out whether the patient has walked in pregnant herself or she has come to us for a pre-pregnancy counseling. When she comes to us for a pre-pregnancy counseling, half the battle is won here. We take a very good history as usual for every patient we have and look into the psychological status of the mother, the nutritional status of the mother, the medical complications, and why she has come for a high-risk pregnancy counseling. Some few things are sometimes very simple, sometimes very complicated. Whatever it is, the way an obstetrician counsels her patient, her confidence that is instilled confidence to her patient always matters. So we can counsel the mother isolated as well as sitting with all the family members or the couple together. We have to first give a lot of time to such a patient coming to us because she must have visited other doctors with a lot of reports and wants us to hear what she is telling. So I always spend around 20 to 25 minutes going through her reports one by one, taking her history, because sometimes we have to do a bereavement counseling also. If she already had a miscarriage or recurrent pregnancy loss or has a medical complication which is very difficult to manage in pregnancy, we should patiently listen to her, then give our opinion. We should also take into consideration the concerns of the immediate family members who are present with her. Our first priority is to make her mental state such that she is able to again carry the next pregnancy, which might be laden with a lot of complications this time too. And if required, we have a joint counseling with a dietitian, a psychiatrist, a medicine specialist or a surgery specialist as it is required. Now coming to patients who have entered our chamber pregnant, she might be in different stages. She might be in the first trimester, early pregnancy, middle pregnancy, or in the last trimester when very few things can be done for her. Whatever it is, and a doctor should always instill hope in the patient, encourage her patient and give her confidence to carry on from wherever we get our patients. So if she is in the first trimester, again we should know her psychology and accordingly the nutritional status, whether she is a vegetarian or non-vegetarian, what we are going to do about the medical complications. And again, if we have to consult one of our colleagues, we should have a joint counseling and give my opinion to the patient so clearly that whenever she comes to me, she is confident that no, I am going to carry on with this doctor and I am going to carry on this pregnancy with all the risks that are there. If she is in the middle stage of pregnancy, again we can prevent many things with our knowledge experience, but when she is in the last stage of pregnancy and comes to us with a lot of hope, whether we know we can take the pregnancy from here as progressing well or not very well, initially when we meet the patient, we should not discourage her. So the words we speak, the looks we have in front of the patient, and the tender loving care that we can give as doctors from our side should be sufficient for the family to have the positive energy to carry on with this pregnancy. Many a times we are not happy with the patients coming with previous reports or the way they have been consulted previously. But we have to be very careful, and when you come to us in Bhagirathi Neotia, we can manage such pregnancies from there with a lot of hope and encouragement and support from our other medical colleagues. So I will always expect you to enter our hospital with positive energy and come to me for any high risk pregnancy which you feel that needs a tertiary care setup and a good obstetrician. Thank you.